Welcome to our presentation on California Physical Therapy, Supervision and Delegation. My name is Zachary Edgar, and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to physical, occupational, and speech therapy practices. Members can access our wide selection of guides and sample policies on federal and state law, along with our guides and updates on private payers. Members can also simply email us at any time with any compliance or billing questions or arrange a phone call. We also offer more comprehensive services like compliance and billing audits, custom policies and procedures, and credentialing. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. These are tasks that only a licensed physical therapist can perform and cannot delegate to an assistant or an aide. A PT shall perform measurement, data collection, or care prior to the evaluation of the patient, document patient evaluation and reevaluations, establish or change a plan of care, write progress reports to another healthcare professional as distinguished from daily chart notes, write a discharge summary, be the sole physical therapy representative in any meeting with other healthcare professionals where the patient's plan of care is assessed or may be modified, and supervise a physical therapy aide performing patient-related tasks, and provide treatment if the physical therapy assistant holds a management position in the physical therapy business where the care is being provided. A management position means that a position that has control or influence over scheduling, hiring, or firing. The physical therapist of record is the PT who performs the initial evaluation of a patient, and the physical therapist of record shall remain as such until a reassignment of the patient to another PT of record has occurred. The PT of record shall ensure that a written system of transfer to the succeeding PT exists. The supervision ratio. A PT shall not supervise more than 2 PTAs at one time to assist the PT in his or her practice of physical therapy. A PT may utilize the services of one aide engaged in patient-related tasks to aid the PT in his or her practice. A physical therapy assistant may not perform measurement, data collection, or care prior to the evaluation of the patient, document the patient's evaluation or reevaluation, write a discharge summary, establish or change a plan of care, write progress reports to another healthcare professional as distinguished from daily chart notes, be the sole physical therapy representative in any meeting or with other healthcare professionals where the patient's plan of care is assessed or modified, supervise a physical therapy aide performing patient-related tasks, and provide treatment if the PTA holds a management position in the physical therapy business, which means a position that involves control or influence over scheduling, hiring, or firing. A physical therapy assistant is not prohibited from collecting and documenting data, administering standard tests, or taking measurements related to patient status. A licensed PT shall at all times be responsible for the extent, kind, quality, and documentation of all physical therapy services provided by the assistant. The supervising PT shall determine which elements of the treatment plan, if any, shall be assigned to the PTA. Assignment of patient care shall be commensurate with the competence of the PTA. A PT shall ensure that the PTA does not function autonomously. The PT has continuing responsibility to follow the progress of each patient and is responsible for determining the elements of a treatment plan that may be assigned to a PTA. The PT of record shall provide supervision and direction to the PTA in the treatment of patients to whom the PTA is providing care. The PTA shall be able to identify and communicate with the PT of record at all times during the treatment of a patient. And a PT shall not supervise more than 2 PTAs at one time to assist the PT in his or her practice of physical therapy. The PTA shall notify the PT of record, document in the patient record any change in the patient's condition not within the plan progress or treatment goals, and any change in the patient's general condition. Only a person licensed as a PTA by the board may use the title physical therapy assistant or the letters PTA, or any words, letters, or figures that indicate that the person is a physical therapy assistant. The license of a physical therapy assistant shall not authorize the use of the prefix LPT, RPT, PT, or doctor, or the title physical therapist, doctor, or any affix indicating or implying that the physical therapy assistant is a physical therapist or a doctor. As of now, Medicare requires that therapists in private practice or employed by a physician group be on site when an assistant is treating a patient. The 2025 proposed physician fee schedule will change that rule to general supervision so that therapists can be off-site when assistants are treating patients, though therapists will need to be available by phone. For states with more restrictive supervision levels, such as direct supervision, those therapy services are always furnished to the extent that is permitted under state law. And if it's required that you be on site by state law, you will still need to be on site when treating a Medicare patient. Most payers and state Medicaid programs defer to the state's physical or occupational therapy board rules for the supervision of assistants, but may require more frequent reassessments. TRICARE follows the Medicare rules and requires on-site supervision and have yet to propose a change to that rule. A physical therapy aide is an unlicensed person who may be utilized by a PT in his or her practice by performing non-patient related tasks or by performing patient-related tasks. An aide shall not independently perform physical therapy or any physical therapy procedure. Prior to the aide providing patient-related care, a PT shall evaluate and document the aide's competency level for performing the patient-related task that the aide will provide in that setting. The record of competencies shall be made available to the board or any PT utilizing that aide upon request. The PT shall be responsible at all times for conduct of the aide while the aide is performing any task patient or non-patient related. A patient-related task means a physical therapy service rendered directly to the patient by an aide excluding non-patient-related tasks. A non-patient-related task means a task related to the observation of the patient, transport of the patient, physical support only during gait or transfer, housekeeping duties, clerical duties, and similar functions. The PT shall provide continuous and immediate supervision of the aide. The PT shall be in the same facility as the aide and in immediate proximity to the location where the aide is performing patient-related tasks. The PT shall be readily available at all times to provide immediate advice, instruction, or intervention in the care of the patient. When the patient-related tasks are provided to a patient by an aide, the PT shall be at some point during the treatment day provide direct service to the patient as treatment for the patient's condition or to further evaluate and monitor the patient's progress. A physical therapy assistant cannot supervise a physical therapy aide performing patient-related tasks. The PT shall require all physical therapy aides performing patient-related tasks under his or her supervision to display while working his or her name and working title in the tag in at least 18-point type. Medicare, TRICARE, and most Medicaid programs expressly state not to bill for the services of aides. Most private payers state that services must be performed by a licensed therapist or an assistant under their supervision. Do not bill for services provided by aides unless the payer guide expressly allows you to. I've never seen a payer allow billing for aide services and really would recommend never doing it. Thank you for watching, and please visit the website for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe. We'll be adding many more videos soon.